Dr. Deuk here with my patient here at Deuk Spine Institute, and this gentleman has had a Deuk laser disc repair done on his lower back for 2 herniated discs, L45, L5S1. And we did that 6 weeks ago?
Yes.
So why did you have the Deuk laser disc repair endoscopic surgery for your herniated disc? What kind of problems were you having?
Well, I had low back pain for around 10 years, and for the last year and a half, 2 years, it had progressively gotten noticeably worse, where it would be aggravated and I have to be down for a week to 4 weeks doing physical therapy and just recovering before I could really do much of anything. And then I had a more acute instance where it extruded the disc, and then I was having shock waves down my left leg and loss of feeling and loss of strength in my left leg. So it was very concerning.
So you had the Deuk laser disc repair done, where we fixed those 2 herniated discs, unpinched the nerve. And how much back pain are you having now? The pain that you used to have before surgery?
I have almost no pain in my back.
So we cured your back pain.
Yeah.
And your leg? How about that leg pain?
I haven't had any leg pain since the day after the surgery.
Great. So the surgery cured your back pain and your leg pain?
Correct.
And you didn't have to have any major open surgery?
Correct. And it's been 6 weeks and you can barely even notice the scar from the incision.
Yeah, it's 7mm tiny scar. You happy with the results of the surgery?
Absolutely.
What do you tell people out there that live with back pain every day and they're looking for some type of topical herb or something to ease up the pain, and rather than getting it fixed? Is this something that's fixable, or is it something you just have to live with and kind of treat with medications or drugs?
Well, it's definitely something fixable, and I think one of the biggest issues that most people have is they're only aware of traditional techniques that cause more trauma to the body than what you already have potentially. So when there's an option like this that's minimally invasive and they don't, damage bones and cut your back wide open, but they can fix your problem, you need to speak with Dr. Deuk to see if you're a candidate for the surgery, because it can be repaired without causing more damage.
Exactly. That's a really important message. Thank you for saying that. So what are you going to do now that your back is fixed? What are your plans? How does that change your life?
Well, plan to get back to cycling and doing a lot more activities that I had done years ago, and progressively over the last few years I've been able to do less and less because they would aggravate my back.
Do you have children?
Yes. Yep.
How does back pain affect your relationship with your kids or your spouse?
I see more of an effect with my son. He's 7, and so I had gotten to the point where I couldn't pick him up and play with him as much, and so I'm looking forward to getting back to being a little more free on that side.
Good. Anything else you want to say to your audience before we wrap this up?
Nope, just if you have back pain that's been bugging you for a long time or pretty significant, even if other doctors have told you surgery is not worth it, just take some medications, you should definitely reach out to Dr. Deuk and see if you're a candidate, because it's a whole new avenue that you probably haven't explored, and it's a really great option to just get on with your life and live your best life.
Well, thank you. Appreciate it. Good luck to you and enjoy your family time.
Thank you.